Ataxia is a lack of coordination, basically, and it starts from a Greek word, and A is lack, and taxos is coordination, order. So everything that moves in our body needs coordination. So you have an uncoordinated gait, an uncoordinated movement of your upper limbs, eyes, and speech. Is as well have to be coordinated, swallowing coordinated. So basically this ataxia and all the symptoms that are related with it, you can see that it's a very complex disorder. The ataxia in particular, they are a very rare group of disorders, are really important to see many of these patients with such a rare disorders, to understand better the complexity of the symptoms, and therefore try to understand how to manage. So it's a much more an evidence-based approach rather than seeing patients with such a rare diseases and having difficulties in disentangled the complexity. So one thing is as well is really relevant, as I mentioned before, defining ataxias, is to have patients with speech and problem in communicating. So it is really relevant to see the same team with an expertise in ataxias that can communicate effectively with the patients, and also to identify symptoms that can be then treated either with drugs or with devices to improve quality of life. Unfortunately, for this complex disorders, there is no causative cure, so it is really paramount to look at the quality of life. Seeing so many patients with such a rare disorders, this is a great opportunity for research to then inform and empower patients to make their own choice to participate in different research. We have been extremely successful at the Ataxia centers to, for example, recruit in record time, according to the pharma who sponsor the trials, and also to enroll patients in natural history, where we have multinational, multi-centers, and we have been successful to enroll basically the majority of the patients for this natural history. And here with me is Nigel Kilvington, who has been as well involved in the design of the protocol. So patients are not only in the Ataxia Center have an opportunity to be recruited in this research project, but also indeed to have a voice in the design of the protocol.
I was diagnosed 10 years ago, which was following a holiday where I noticed my speech deteriorating, and I was having problems walking downstairs. My doctor referred me to a neurologist, who then ran various tests and sent me for a second opinion to London, to the National Institute, and they ran blood tests, and there was a positive diagnosis. I've been involved in both the natural history trial, the idebenone trial, and the nicotinamide trial. All of them very positive with the treatment and care over the time that they take. I've been asked to review with some input on the protocols of some of the other trials. Also through Ataxia UK, I have been very fortunate to be a member of the scientific advisory committee as a lay member.
So Ataxia UK is a charity that provides support for people with ataxia and their families. We have a helpline, information leaflets, and importantly we provide an opportunity for people with this group of rare conditions to actually meet, because in many cases it's quite isolating and people might not have met anybody else with the condition before, might feel like they're the only person in the world. So it's really important to bring people together. Ataxia UK is also very involved in research. And we have a research programme where we fund research projects, and we have a scientific advisory committee to advise us. And as Nigel Kilvington was saying, he was actually a lay member on that committee. And to us it's very important to involve patients in all aspects of the work we do, and importantly in research, in helping us decide which is the most relevant research that would have an impact on people with ataxia. As well as funding research, we're also very engaged in helping the research process. So we have a registry of a large number of ataxia patients, so we're able to assist researchers in trying to recruit for studies. And that's trials, natural history studies, but also importantly studies that maybe don't appear as exciting, such as questionnaires, which are also very important in the whole research process. So that's one aspect of the work we do. We were also very engaged in setting up the specialist ataxia clinics, and that is an example of where we really sort of drew in the patients and the clinicians and consulted them in what would be the best thing to how we set up these specialist clinics. So we engaged with them to sort of set up a number of criteria for these clinics to comply by. And there were things like we needed to have a neurologist with a large patient caseload and many years' experience of ataxia to run such clinics. And patients particularly wanted follow-up appointments, so not just being left and discharged, but being seen on an annual basis and seeing the same neurologist, so that continuity of care, that's very important. And another aspect was that these centres had to be really engaged in research. And as we've heard from the London Ataxia Centre, which was the first centre we established, and Dr. Giunti running it, there has been a really good example of successful research studies taking place there. Another feature of the London Ataxia Clinic that was really successful and then was rolled out in other centres was the involvement of volunteer scheme. So these are Ataxia UK representatives who are volunteering their time and are attending the ataxia clinics. And we have with us today two of the volunteers at the clinic, Anne and John Chapman, who will tell us a little bit about their role.
My link with ataxia is because our son was born 1970, and age 3 I knew there was something wrong with him. And I was a health visitor at the time, and I knew that there was a neurological group about ataxia, and I knew we were looking at a neurological problem root. And we didn't get a diagnosis properly for Christopher until he was age 18, before he went to university. And that was, in that time, I'd followed the fortunes of Ataxia UK as they actually blossomed into a very good organisation with a huge amount of information and help. And also Christopher came here to the neurological hospital to be seen as a patient. And then after Christopher died, we continued with Ataxia UK, went to all the conferences with Christopher. And then when Christopher died, we knew there were volunteers. And as a parent, you actually amass a huge amount of information, and it was really quite useful to be able to come and be a volunteer and to help. Lots of people come to the clinic. It's exhausting. They are emotionally exhausted, they're physically exhausted, and if it's the first time to see Dr. Giunti, then they need the time to actually listen to all the information and recover afterwards. And so sitting quietly and talking through, has anything been missed? Are there various problems? Ataxia UK has a very good helpline. We try and make sure that nothing has been missed and that the clinic is covered all of the aspects of how people are going to carry on with their lives.
Our role at the clinic is twofold. One is to ensure that the people, as we represent Ataxia UK, are aware of Ataxia UK, that we are fulfilling their needs if they're already aware, and to make sure that they know all of the types of services that Ataxia UK can provide to them. And the second one is to give feedback to Dr. Giunti and the authorities in terms of how the clinic is received by the patients. So we sit down, as Anne has said, talk to them quietly, let them reflect on the session they've had with Dr. Giunti, pick up on anything that they've suddenly remembered that they've forgotten, try and advise them to be better prepared next time with questions so that they don't fall into that trap, or to remind them how to get in contact with Dr. Giunti and the rest of her staff if something really bugs them in between their appointments. The way we get the feedback is through a form. We ask the questions in terms of their experience. That is analysed by Ataxia UK, fed back to Dr. Giunti, in order that as things arise as to how people perceive the service that is provided by Dr. Giunti and by Ataxia UK, that we can meet their needs if they express opinions where we have gaps or better ways of approaching things that they would prefer to see. And like, so we have regular sessions on discussing those aspects for the improvements for the future.
It's been noticeable as a volunteer, and having seen how Ataxia UK has progressed and seen the big step up in the research that's going on, not just in this country but around the world, that actually those that are asked to take part in research really feel valued, and actually they come to the clinic happy to be asked to come to the clinic. And despite the fact that some of them have to do long journeys, or it's usually a day for a lot of people, and that they have definitely felt valued, that they're part of this scheme.
Yeah, I understood the really important and crucial relationship with working in partnership with patients and patients group since the beginning of my career, and since the 90s, when I was involved in a door-to-door project that allowed me to see patients in their own home, and the research project was basically finding the gene, identifying new genes, and my project involved me seeing the patients, examining the patients, and then collecting blood, and then running to the lab and try to identify the genes. So that has been really informative for me, because without me informing the patients, involving the patients, and having a really great understanding of what they need, it was never been successful as it has been. This has been then, this approach has been carried out until these days, and allowed me to run successfully many research projects, including the natural history, as I mentioned before, and more recently clinical trials. So yes, it's really very important, and the importance is so that I also ask, as Julie before mentioned, ask the Ataxia UK volunteer to come into the clinic and help me.